Thank you so much to everyone for joining us. My name is Tim Anderson. I am the Director of Policy at the Council of State Government's Midwestern office. As most of you know, CSG is a national nonpartisan association of states. And among the groups of state officials that CSG supports is the Midwestern Legislative Conference, or the MLC, which is made up of legislators from 11 Midwestern states and the Canadian province of Saskatchewan. Additionally, the provinces of Alberta, Manitoba, and Ontario are affiliate members of the MLC. So organizing this webinar today is our MLC Criminal Justice and Public Safety Committee. Our three committee officers are Wisconsin Senator Jesse James, Nebraska Senator John Kavanaugh, and Ohio Senator Michelle Reynolds. I will be turning over the webinar to Senator James in just a moment. But just to kind of make sure as a stage setter, just to let you know, our committee, as well as the 5 other committees of CSG's Midwestern Legislative Conference, is wrapping up its work for the biennium with a 5-part webinar series for state and provincial legislators and staff, along with anyone else interested in the topics that are being presented. We have a great attendance for this event, and we appreciate everyone who's on here this afternoon. This screen will show the topics of the webinar series, the rest of it. You can find more information and register for any of the upcoming webinars in the series at csgmidwest.org. Christina, can you go back to that slide for 1 second that shows all the committee, do we have that slide of all the other webinars? Maybe we don't. Okay. Well, anyways, all the other webinars this week can be found at csgmidwest.org. On this afternoon's webinar, we're going to be hearing from some leading experts and practitioners regarding youth violence indicators, as well as best practices for helping to lower incidences of violence among adolescents. We also hope to hear from you on this webinar, along with any questions or comments you have about what is presented. We would also welcome your insights at the end of the session. Think about any notable developments in your states or provinces, new laws regarding this topic, new legislation, work you have planned for 2025. We would appreciate hearing from you this afternoon. You can always raise your hand or type a question or comment in the Q&A feature on your screen. So again, I'd like to thank all of our committee officers for their leadership on the MLC Criminal Justice and Public Safety Committee during the course of this biennium. And right now, I'm going to turn the webinar over to one of those leaders, and a real important leader in his own state, Wisconsin Senator Jesse James. Senator James.
Good afternoon, everyone. Thank you, Tim, and thank you to my legislative colleagues and everyone else on today's webinar. We're pleased to have close to over 300 registrants from across the Midwest and beyond for today's webinar entitled Prevent Violence, Transform Young Lives, the promise of comprehensive adolescent services and the role for states. We're going to hear from 3 terrific speakers today. Delreese Adams, who is the Executive Director of the Illinois Criminal Justice Information Authority, Josh Weber, Deputy Director of the CSG Justice Center's Correction and Reentry Division, and Mark Zimmerman, who heads up the Michigan Youth Violence Prevention Center. To set the stage, we're going to hear first from Josh Weber. For the last decade, Josh has overseen the CSG Justice Center's youth and juvenile justice work, which focuses on helping states use effective methods to reduce recidivism and improve outcomes for youth in contact with the juvenile justice system. Previously, he spent 15 years working on building the capacity of programs and systems that serve vulnerable youth in the juvenile justice, youth development, workforce development, and child welfare systems. Josh managed research programs for Youth Development and Research Fund in Maryland and the Chapman Hall at the University of Chicago. In addition, Josh led the development and implementation of the NYC Administration for Children's Services, Alternative to Placement and Reentry Program for juveniles using evidence-based practices. He also directed the District of Columbia's Justice Grants Administration, which managed all federal juvenile and criminal justice grants for the district. Today, Josh is going to help us better understand the problem of youth violence in the United States, including the level of trauma youth experience, issues facing agencies, schools, and prison that may contribute to the rise in youth violence, and the opportunity for states to develop a new vision and approach for comprehensively addressing the needs of youth and families to protect public safety and improve youth outcomes. Welcome, Josh.
Thank you, Senator, and thank you to CSG Midwest for this opportunity. Next slide. As Senator James mentioned, I'm Josh Weber. I oversee all of the juvenile justice and youth work at the Council of State Governments Justice Center. The Justice Center is an affiliate of the Council of State Governments, over 200-person national nonprofit organization that works across all branches of state government and local government to focus on evidence-based effective strategies for youth and adults in the justice system. Next slide. I've been with the Justice Center for over a decade, and during that time have overseen our juvenile justice work, and we've had the opportunity to work in a comprehensive way with multiple states as well as counties all across the country to help them adopt and implement evidence-based strategies to improve public safety and youth outcomes. Next slide. Currently, concerns around youth crime and youth violence are probably at their highest since the mid-90s. And so in order to respond to policymaker and public concerns around this issue, we spent the last year or more analyzing the most recent data available on youth crime, violence, and behavioral health to make sure policymakers can really ground their public safety decisions in the data on what's actually happening when it comes to young people. So I'm going to share just a summary of the key takeaways from that data analysis and key implications for states. And the first key point really is that while any amount of youth crime and youth violence is a concern, it's important to note that youth arrests for violent offenses actually remain historically low. But also at the same time, during the pandemic, youth arrests for homicide and weapons offenses did surge. Next slide. So based on, next slide, please. Based on 2022 data, which is the most recent youth crime and violence data available, total juvenile crime has actually declined by 80% over the last 25 years. And crimes for violent offenses, which include aggravated assault, robbery, rape, and homicide, have also declined over 50% over the last 22 years. You can see at the tail end of the graph in 2022 that violence overall, arrests for youth violence, were at their lowest level in the last 25 years, other than the artificial lows in 2020 of the pandemic. So overall, within a historical context, juvenile crime significantly lower and youth violence also significantly lower. Next slide. But what did change during the pandemic is arrests for youth homicides surged. So you can see starting in 2012, there was a slight ongoing increase in the number of arrests for youth homicides, but really a significant spike coming out of the pandemic into 2022 to levels really not seen in the last 25 years. Next slide. As a result of these homicide challenges and violence, homicide and suicide are now actually the leading cause of death among young people ages 15 to 19, obviously particularly impacting young people of color. And much of this violence is gun violence, and in half of all cases in which a young person committed a violent crime, the victim was also a minor. So very much driven by gun violence, peer-to-peer violence, and disproportionately impacts communities of color. The rate of firearm deaths among Black youth in 2022 was 20 times higher than white youth. And this is no longer just a large urban area challenge. The rates of gun violence victimization for Black youth in rural areas actually the same and equal to urban areas, and gun possession amongst youth in rural communities increased at the fastest rate post-pandemic than any other type of community. Next slide. It's also important, though, to look at trends over the longer term. And while we're still processing data from 2023 and 2024, there isn't youth-specific data. The data that we do have available shows that just as the murder rate increased significantly during the pandemic, in 2023, the murder rate also declined just as historically by a large amount in 2023. Data also shows initially for 2024 that the murder rate has continued to decline and the violent crime rate has also continued to decline. So obviously, one young person committing a homicide or a violent offense, one victim is one too many, but it's important to keep this historical data in context because what we know from the last few decades is that more punitive approaches to addressing youth crime, addressing violence and victimization are not likely to be successful. And instead, states really have to focus at the underlying issues driving young people's behavior. Next slide. And what we found in the data, and what you've probably seen in the news and elsewhere, is one of those underlying key issues for youth crime and youth violence is adolescents' behavioral health. And adolescents are increasingly struggling with mental health issues that can impact their own well-being or their risk to others. And public systems and providers are really struggling over the last couple of years to address these needs. Next slide. So based on 2023 CDC data, every 2 years, CDC does a national survey of all high school students across the country. What we find is adolescents are experiencing unprecedented mental health challenges that started before the COVID-19 pandemic, but have been accelerated by the pandemic. Almost 1 in 3 of all high school students in 2023 reported that their mental health was not good most of the time or always. 40% expressed feeling consistently sad or hopeless, compared to 26% in 2009. And somewhat shockingly, that includes over half of all female students and almost 2/3 of all LGBTQ students. 1 in 5 high school students also reported seriously considering attempting suicide. And while overall substance use, alcohol use, tobacco use has declined amongst high school students, overdose deaths have increased, largely due to opioids, including a 109% increase in overdose deaths during the pandemic. Next slide. Adolescents are also not just experiencing increasing mental health challenges, but they're also experiencing significant trauma in their homes, family, and community that can also lead to self-harm, family conflict, violence, and involvement in the juvenile justice or child welfare system. Over half of all high school students said they experienced emotional abuse by an adult at home. More than 10% reported physical abuse. And more than 10% reported experiencing sexual violence, including almost 1 in 5 girls and LGBTQ youth. 1 in 5 students say they witnessed someone getting physically attacked, beaten, stabbed, or shot in their neighborhood, including almost 30% of Black students. And more than 1 in 3 high school students said that they've experienced racism. And we know increasingly from looking at data that up to 2/3 of young people in the juvenile justice system have mental health, have trauma issues, and that these trauma issues, if they're not addressed, can result in young people acting out and increasing conflict in their homes or in the community. Next slide. We also know that most states really lack a formal adolescent behavioral health system. In many ways, the juvenile justice system is sometimes the default behavioral health system. Nationally, 5 million young people have at least one major depressive episode, 3 million with a severe depressive episode, and really only about half of those young people, based on available data, actually receive mental health services, and only about half with more severe issues receive consistent treatment. Next slide. And we also know that both public agencies and providers are struggling with unprecedented staffing challenges. We did a national survey, and 85% of public agencies said that they are having moderate or severe challenges hiring and retaining staff. 80% said they were having significant challenges with retention and hiring of service provider staff, and less than 10% of survey respondents felt that their state had a plan to address these staffing challenges. Next slide. And we also know that schools, which have traditionally been an outlet for identifying young people with behavioral health needs and providing necessary services, are also struggling. During the pandemic, school absenteeism, which is defined as more than missing 10% of the school year, also surged to over 1/3 of all students experiencing chronic absenteeism. Next slide. The risk with increasing concerns around youth crime and youth violence is that many of these young people who are not a public safety risk but have behavioral health needs get pushed into the juvenile justice system to get services. But we know from a lot of research that the juvenile justice system is not actually a great place for most kids. Next slide. Based on comparison research that looks at young people who were involved in the juvenile justice system versus young people who were diverted, research consistently shows that similar young people who become formally processed by the system, that act and system decision can negatively impact the entire course of their lives. Kids who are involved in the juvenile justice system compared to their peers who are diverted are actually more likely to get rearrested, more likely to engage in violence, and have lower school attainment and employment rates and more mental health and trauma issues than their peers. Next slide. And in fact, most youth who become involved in the juvenile justice system today are not youth who commit violent offenses. Only about 5% of all kids involved in the system have committed a violent offense. And instead, 70% of all kids nationwide who are arrested have committed an offense that didn't involve physical harm to another person. Almost 2/3 of all kids who were placed on probation did not commit a person offense, and almost 2/3 of kids who are incarcerated did not commit a person offense. So right now, the juvenile justice system is still being used by many states as a default service provider system and not always focused on the kids that are the largest public safety risk. Next slide. And that disproportionately impacts youth of color who are more likely to get pushed into the juvenile justice system. While youth crime and youth violence has shrunk over the last 25 years, disparities in system involvement have actually gotten worse. Black youth compared to white youth are 2.5 times more likely to be rearrested, almost 3 times more likely to be referred to court, almost 5 times more likely to be detained, and 6 times more likely to be incarcerated than their white peers. Next slide. So we really encourage states to take a transformational approach to how to address public safety concerns and to mitigate youth crime, violence, and behavioral health. Next slide. And that really focuses on 3 core strategies. The first strategy is around developing an early intervention system so that youth and families can get the help they need before behaviors escalate, before young people become really at risk of violence or other types of damaging behaviors. And that includes a centralized resource or structure or place for youth and families to get services. That is an alternative to police contact or hospitalization, alternative responses, mobile crisis, assessment centers, resource centers, opportunities for respite and shelter so that there's a cooling off period if youth need to be away from home, peer incredible messenger programs and wraparound services that can connect young people to needed services and supports, and restorative justice practices that can provide opportunities for youth to repair any harm caused to victims or communities. Next slide. The second objective is really to focus on what actually works for higher risk youth in terms of recidivism reduction. And that really is research-based, community-based services to both mitigate violence as well as general crime risk. That includes street teams and violence interrupter programs like Cure Violence and Operation Ceasefire. It includes evidence-based interventions like cognitive behavioral therapy, trauma-informed CBT, hospital-based programs, and victim supports. It includes not just risk reduction and violence reduction services, but pathways to education, employment, and economic opportunity for young people. And really includes a focus on building out a robust continuum of services that isn't just a focus on more services, but effective services and the right services. We've worked with states and done evaluations and found oftentimes, unfortunately, that services are not implemented well. And if that's the case, they often have few, if any, recidivism reduction benefits. So providers need training, support, and quality assurance to make sure that they're implementing these programs effectively. Next slide. And then finally, really is a statewide strategy to address public agency and provider quality and gaps. Is really paying people what they're worth in terms of the qualifications and experiences required to work with the most complex, highest risk youth in your state, and really developing workforce pipelines, provider capacity building strategies, funding rate strategies that really recognize that if we care about public safety and we care about youth outcomes, we need to build the providers and workforce to do this work well. Next slide. Finally, I just want to highlight a way that the Justice Center is helping to support states in this work. We have just launched our new Collaborating for Youth and Public Safety initiative, which is to really provide states with technical assistance and support to bring multiple systems together to advance those objectives that I just talked through. And if that's of interest at all to any of the state leaders on this call, you can feel free to reach out to me. Thank you.
Thank you, Josh. Now we'll hear from two presenters who are working to help prevent violence in their states of Illinois and Michigan. First to Illinois. Delreese Adams is a justice warrior with over 25 years of directing social service and public health reform efforts. At the beginning of 2020, Illinois Governor J.B. Pritzker appointed Delreese to lead the Illinois Criminal Justice Information Authority, ICJIA. ICJIA spearheads and informs on public safety policies, research, and best practices. In this role, Executive Director Adams leverages her expertise in criminal justice, violence prevention, and racial equity to support the agency's work. Her expertise informs and enhances public safety priorities, equity grant administration, and evidence-based solutions to violence prevention. Executive Director Adams institutes a transparent and straightforward approach to the work. Equity, fairness, and opportunity are the priorities of every grant program and policy administered by the authority. A visionary leader trained in trauma-informed approaches, Executive Director Adams co-chairs a first-of-its-kind cross-governmental violence prevention advisory group with county and city officials. She also chairs or administers various state boards and commissions, such as the Ad Hoc Victim Service and Prevention Committee, Domestic Violence Pretrial Working Group, and Violent Crime Reduction Task Force. Nationally, she is the chair of the National Criminal Justice Association's Board of Directors, Equity and Criminal Justice Funding and Budget Committee. Previously, Executive Director Adams held progressive leadership roles at the Cook County Justice Advisory Council and the City of Chicago's Department of Public Health Office of Violence Prevention and Behavioral Health. She was responsible for the restorative justice and violence prevention initiatives. In these roles, a trained peace circle keeper, Executive Director Adams' successes are grounded in her love for and strong ties with the community. In July 2022, Executive Director Adams was selected into the highly competitive National Criminal Justice Association Leadership Academy for Executives, where she represented the represented the great state of Illinois. She received a bachelor's degree in psychology from the University of California at Berkeley and holds a master's degree in social service administration from the University of Chicago. In 2020, the Illinois Criminal Justice Information Authority released a statewide violence prevention plan for 2020 to 2024. Today, Executive Director Adams is going to share with us how the plan was developed, components of the plan that work towards preventing youth violence, and lessons learned as the plan is being implemented. Welcome, Delreese Adams.
Thank you so much, Senator James. I was thinking, like, why is my whole bio a part of this? And I think it's because I'm not a researcher. People feel like I got to have a good, strong bio, right, to give us credibility. I am very happy to be here, and thank you so much for inviting me today to talk about the work that's happening in Illinois. And you can hear violence prevention from a state perspective. Next slide. As we just heard Professor Weber talk about, Josh really gave us some great data and information on crime and victimization in youth that's taken place. We all know that violence remains a public health crisis. And for Illinois, it is a leading cause of death for not just individuals, but youth. Youth violence is a significant public health issue with young people ages 10 to 24 disproportionately impacted. The CDC identifies it as one of the leading causes of death of this age group, directly affecting not only families, but these individuals' health, education, and future opportunities. In Illinois, we focus on prevention through equity by addressing systemic inequities that disproportionately expose youth to violence, such as poverty, oppression, and lack of access to resources. Next slide. So ICEJA's response to healing the harm in communities across Illinois is our statewide violence prevention plan. In 2019, we had a state mandate, next slide, that gave the authority basically a legislative mandate to be the lead in a comprehensive 4-year statewide plan that integrated public health, public safety, and victim support services. Next slide. So what we did, we established a partnership with the University of Illinois and 13 state agencies as stakeholders. And that allowed ICEJA to incorporate data-driven insights and community input from all over the state, all 102 counties. Utilizing surveys and research, we were able to show significant disparities in violence exposure by geography, race, and socioeconomic status. And the role of the statewide plan was then to have all of these system partners and subject matter experts help to raise up priority areas so that organizations had a roadmap, if you will, to addressing these systemic barriers. We also knew that it was important that they address the great disparities in youth victimization that exist across all racial, ethnic, and geographic lines in Illinois. What we know is that 58% of Illinois youth report exposure to adverse childhood experiences. And we knew that as a state, we had to be committed to building resilience in young populations through community-based programmings like restorative justice in schools, mentoring, workforce development at an early age, career matching. Those have all been proven to be effective in bridging gaps caused by systemic inequities. We also understood that from the provider perspective, they needed more support in the prevention space. Some of our data and research showed that there was a lot of dollars being put into intervention, but prevention was our lowest funded area. And as we know, if we want to touch young lives, we really have to boost up and make more resource funding for the prevention space. Things, again, like mentorship, mental health services, and after school programs for our young people so that we're able to grasp them at that age and offset or decrease some of the adverse childhood experiences that are taking place that lead into some of the adult behaviors where we have mass incarceration and other areas where you can see the effects of young people living in poverty oppression and lack of opportunities, how those play out into adult behaviors. We also understood that inequities and victimization was important to look at. Programs, we began to fund programs that help to reverse some of the rates of violence that we were seeing in marginalized communities, not just across all youth, but from racial and ethnic minorities and the LGBTQ plus groups. Again, we targeted high ACEs and the prevalence in Illinois and understood the need for trauma-informed, evidence-based violence prevention services. Next slide. As some of you'll hear more and more today, and Josh was also able to highlight, homicide and suicide death rates were at the highest in 2020 and 2021. Where in Illinois, there is a slight decline in homicides, it is still the leading cause of death of young people of color. And so one of the things that all of our agencies came together, and we also had external partners who were in the space delivering services, they all kind of done these surveys, gathered research, understood what was happening in their service provisions. And one thing that rose up as a priority was social connectedness, understanding that if they could reduce I would say the opportunities and the way that young people feel connected to their communities, they could also reduce the risky behavior. So we began to focus on that as a vital prevention strategy. One of the approaches that we had people look at is what was the level of prevention services in their organizations versus the reactionary or intervention services where they were providing very intense supports once an incident had happened, but how much of the service provisions were happening to prevent, to really increase those risk factors, to decrease those risk factors and improve some of those protective factors, such as helping them with their schoolwork, enhancement programs like sports programs. We mentioned peer mentoring and after school programs. Those are all protective factors that help young people as they try to address a system that oftentimes does not speak directly to their needs. Studies also show that 30% reduction in youth violence also occurs when young people feel that sense of belonging and connectedness. So it was very important that our plan was not only comprehensive in the sense that there were all types of services being provided, both prevention and intervention, but that in community, families had comprehensive service provisions that they could access so that they could address all of their young people's issues in a very comprehensive and holistic way. Next slide, please. So the plan, our 5-year violence prevention plan, lifted up goals such as stop violence and promote safety, very broad goals such as supporting children, youth, and families by emphasizing programs that foster social connectedness, advance equity, promote health, and promote collaboration across state, municipal, and community-based agencies. So those were kind of like the 5 centered frameworks in the plan that really gave our organizations framing as to what types of services they should be focusing on, that they should be looking at advancing equity in their work. They should be using data to understand where there were gaps in service provisions, but that all of their work and plans and even proposals to states, government entities for violence prevention dollars should really center around some of the findings of the plan. Next slide, please. So ICEJA, as I mentioned, we developed the plan and implemented it through our Violence Prevention Ad Hoc Committee. That committee met quarterly. Again, it was a very broad, diverse committee that really was made up of state and local government partners, as well as service providers, those most impacted by violence, community members. So we had a very broad voices at the table, helping us to understand when we do release dollars and fundings into community, what are the priorities? And then we would build our notice of funding opportunity as a state around those voices, around those priority areas lifted up by this ad hoc committee. And so our model always included an equitable and transparent process, having outreach and technical assistance to act so that smaller grassroots and localized organizations could access our funding. We also really focused on technical assistance, understanding that we have a saying in Illinois that the knowledge is in the room, that some of our really small localized organizations, they are touching the highest risk populations, but they don't often historical access to funding. So they need things like support with grant writing. So we began to do a lot of outreach as a government entity to make sure that we were supporting these local organizations who really could touch the highest risk youth and the highest risk emerging adults. We also used a lot of data collection. We surveyed over 3,000 youth and their caregivers, trying to understand intergenerational trauma and what protective factors were needed to really reverse the cycle of violence that we were seeing in our youth. Next slide, please. Program, where Illinois takes 25% of its cannabis dollars and places it back into communities for resources, communities most impacted by the war on drugs and historical harms in terms of our policies around criminal justice. We were able to issue in the last 3 years a total of $200 million to local organizations. And as we look at that data from 2020 to 2024, we saw a lot of implementation around those activities that I mentioned earlier, and we were able to see the impact that was happening around programs that really spoke to prevention. So we brought in the ad hoc committee to begin to talk about our 2025-2029 statewide plan, which will be released in January. And before I showed you those 5 goals, bringing the impacted voices, the broad voices of other state agencies, including public health, Illinois Department of Corrections, as well as our Department of Children and Family Services, our Department of Human Services were a part of the ad hoc committee, along with many providers who did work in youth development, violence prevention, reentry. They came together and said we should focus on 3 main goals: preventing violence and promoting health and safety, advancing equity, and promoting collaboration. And so our new plan that you will see released in January, and we will be sure to share broadly, does focus on that, highlighting still youth engagement and encouraging proposals and plans for the next 4 years that can really address adverse childhood experiences, directly involve young people in programming, in feedback, in design. Through equity lens, we will have more impacted voices at the table before we release those notices of funding opportunities to really weigh in on what types of strategies are needed in their communities to address what the various types of violence that young people are experiencing. And lastly, we will continue to do more collaboration to leverage our resources across
Okay, we must have had a little bit, some technical issues here. We missed the last part of what you said exactly.
was actually wrapping up. That was
Yes.
it.
Okay.
You didn't miss much. I was just wrapping up and sharing our plan, but you can see the new plan on our website come January, and we will make sure that it is distributed widely. Thank you for that.
Thank you, Executive Director Adams. Now we're going to hear from Dr. Mark Zimmerman. Dr. Zimmerman is the Marshall H. Becker Collegiate Professor in the Department of Health Behavior and Health Education in the School of Public Health and co-director of the Institute for Firearm Injury Prevention at the University of Michigan. He is the principal investigator and director of the CDC-funded Michigan Youth Violence Prevention Center and Prevention Research Center and co-director of the Bureau of Justice Assistance-funded National Center for School Safety. Dr. Zimmerman has over 35 years of experience studying youth violence. His research focuses on the application and development of empowerment theory and the study of adolescent health and resiliency. He has translated his research on individual and community risk and promotive factors to develop and evaluate community-based programs with an emphasis on the prevention of community violence. His work includes creating the evidence-based program Youth Empowerment Solutions and the development of Busy Streets Theory, which is focused on the effects of urban vacant lot rehabilitation and greening. Dr. Zimmerman is the editor of Youth and Society and editor emerita of Health Education and Behavior. Welcome, Dr. Zimmerman.
Thank you so much, Senator James. I just want to also just let everybody know that there has actually been a shooting in Madison, Wisconsin, your home state, today during this webinar. So the topic is ever more important. There were some deaths being reported, as far as I can tell, and several injuries. So my heart goes out to your state and everybody, their families in the school and that sort of thing. I'll just try to be really quick, because I realize that we probably want some questions and and I can stay on a little bit longer if necessary. If I can go to the next slide. Just real quickly, we are a CDC funded center. It's one of 5 nationally funded by the National Center for Injury Prevention and Control. Next slide. And what we do is we basically evaluate community-based strategies. We're the researchers that do the kind of work that we've been hearing about. We do some of the on-the-ground work. We work with community-based organizations. Next slide. Our current projects are in Flint, Washington, D.C., and Muskegon, Michigan. But we've also worked with folks in Youngstown, Ohio, and Indianapolis. And we have colleagues also in all the states that are represented here, Illinois as well as Wisconsin. But most of our work lately has been in these 3 places. Next slide. We focus on, I'm just talking really fast. I'm originally from New Jersey, but I've lived long enough in Michigan to be a Michigander. But so I'll talk really fast and again, try to get us, in time for at least some questions. So we basically work with the positive youth development, and you heard about busy streets, and then hospital-based interventions. These are our 3 areas that we are mostly focusing on. So let me just tell you a little bit about some of the positive youth development. Next slide. Is that we're focusing currently on addressing root causes, so helping kids understand where they may not be the ones to blame based on all of the things that we just heard about. Sometimes it's the issues in the family, sometimes issues in the community, sometimes issues in the school and the school climate that kind of create a context for them to learn about violence and responding in violent ways, or not having the mental health supports and all the things we've talked about. We work on after school and summer programming, and then it's all focused on community change and community change efforts. So we very much focus on the issues that we talked about in terms of building up the strengths rather than focusing on just what's wrong with kids' lives. And there's no better example of that in our work than Youth Empowerment Solutions. In the next slide. Youth Empowerment Solutions is basically an after-school program for middle school kids. We started with middle school because that's a transitional moment where kids start getting more violent. They start bullying, and then they start acting out in more aggressive and violent ways, and it culminates obviously into the more aggressive and more dangerous kind of violent behavior using weapons, for example. And what this program is basically a scaffolding for creating for helping kids create community change in positive ways. And this pictures show you that they painted this mural. You can see they're first whitewashing it, and then they're standing in front of the center part of that mural. That's not the whole thing. But basically the curriculum goes through them thinking critically about their community, they working together, working with adults, and then culminating in developing a community change project, whether social or physical. And we look at outcomes, and when we look at 3 months post and even a year post, we find kids are less aggressive and more involved in those positive activities, like more engaged in school, see a more positive future for themselves, and are more engaged in community change, other community change efforts. So you can go to this website. I tried to talk a little bit longer on this slide, so that you can go to the website if you're interested. The curriculum is downloadable for free. We have a very low cost virtual training if people are interested in learning how to implement it and what it's all about. But it's all about giving kids the control to actually build the confidence, the leadership skills, and then develop the skills to actually make community change. Next slide. We also are engaged in neighborhood activities and improving neighborhoods. We're working on lots of legacy cities that are all of the states that you guys all represent, and we call that the idea of busy streets. It's working with vacant property maintenance. We recently engaged with a conversation with some local partners about community dumping. We're working on community dumping, and then also it's all about community engagement. And in many cases, it's also about adults working with kids in doing these activities. So it's all about engaging youth in the process as well. Next slide. The next slide is basically we do vacant property maintenance and reuse, and it's gardens, it's just mowing it, it's just cleaning it up. And the idea of busy streets is simply the counterpart to broken windows. The idea of broken windows is one broken window leads to another and leads to the slippery slope of a disorganized neighborhood where people don't have eyes in the street and they feel like they can get away with things and do more nefarious activities. The idea of busy streets is what happens if you build it? Will they come? Will they engage with each other? Will they feel better about themselves? The next slide. And we basically find exactly that. They feel better about themselves, they feel better about their neighbors, and most importantly, we see declines in violent crime and firearm-related crime. And we also see declines in youth-related crime, violent crime, and youth-related firearm incidents. In one of our studies, we found a decrease of 40%, and we're not seeing that it's spreading to the nearby neighborhoods. It actually is lowering the levels in the area. So the dumping prevention is just simply putting indicators that there's no, that people are paying attention again. And here's some before and after pictures. We do quasi-experimental designs. We're actually in the middle of this process right now, and it is part of youth being involved in the process. Next slide. Again, I'm trying to be done so we have some moments for conversation. We also work with hospital interventions. I work with emergency department doctors. They've created this program called Safer Teens. If you go to the next slide, it's a brief intervention for youth who come into the emergency department with an intentional injury of some kind. We are now trying to roll this out into primary care and other settings. But in a randomized controlled trial, we have found that this brief intervention of motivational interviewing has reduced retaliatory behaviors and has reduced violent behaviors with people who participate in the project. And I'll just stop there and ask for the next slide and just say that if anybody's interested in these kinds of programs that obviously have, and I'm happy to discuss possible, policy implications for that. But we work with a land bank. There's a land bank authority in the state of Michigan and about 25 other states in the nation. So there's lots of policy implications that could happen that could be implemented to make this work. After school programs, We're working now in the state of Michigan on seeing if we can get some reimbursement for a project like say for teens through Medicaid. So these are the websites that you could go to. The Youth Violence Prevention Center in particular has a lot of these programs described. So thank you for your attention, and happy to take some questions.
Well, thank you, Dr. Zimmerman, and all of our wonderful panelists we had today. Now we will take some questions from our meeting participants, but first I'd like to have Laura Cleaver, who has been staffing the MLC Criminal Justice and Public Safety Committee, introduce herself and let us know if there are any questions. Laura?
Thank you, Senator James. My name is Laura Cleaver. As Senator James said, I am a senior program manager with the Council of State Governments Midwestern office. I currently serve as the CSG Midwest staff liaison to the MLC's Criminal Justice and Public Safety Committee. I do apologize that I had computer issues earlier, and thank my colleague Tim for taking over. And we do have a few questions. There is one that I think might be of interest to a broader. Is there a database that not only tracks deaths by firearms, but also tracks those non-fatally injured by firearms?
I can speak briefly to that. There is the National Violent Death Reporting System. I think that's in all 50 states now that CDC operates. It identifies all sorts of reasons, for death, and the data do include some information that you're describing. You can go to WISCAR's database. It's a searchable database for your own community, for your own state. I don't think it breaks it down to community, but it does give the information by the state. And WISCAR's is WISQUR, or I don't know this. I'm sorry. You have to go to CDC and WISCAR's, and I don't know that I can look it up while we're talking, but it is available.
Thank you.
This is Josh. I can also add that the FBI went through a large process of kind of recategorizing how it collects arrest and violence data. States are still trying to figure that out, but it allows for a more detailed analysis of crime and violence data. It's the NIBRS dataset, NIBRS. So some of those recent changes, you can go down to the county level, you can look at more specifics around the crime, if a weapon was used, what type of weapon, more information about the victims. The data is only right now available for analysis for 2022, and then the FBI just releases 2023 data. But there is now, and slowly, more detailed data becoming available on crime and violence. It's been one of the historical challenges to making better public policy decisions, is at both the national level and at the state level. There isn't great data, especially for young people. So certainly, I don't know if it's one of the strategies any of us have talked about, but prioritizing better data collection and data collection across systems is really a priority when it comes to a good youth violence prevention strategy.
Yeah, we use our state of Michigan. We get data from the state police, which is what they use to report to the data that Josh was talking about. We get it probably a little bit earlier, but each one of your states could certainly make those data available for for research purposes, either through the great universities you all have, or through state government and whatnot. Those data should be available. And they are broken down by, now those are not necessarily deaths, but they are incidents. So, and sometimes there is information about death. Sometimes the death occurs later. Sometimes there's indication of whether or not it's injury, but there is almost always an indicator that there was a firearm used or that it was a violent act of some kind.
Thank you.
I was gonna just
Director Adams, did you want to say something?
I was gonna just piggyback that each state has a statistical analysis center, and we are Illinois. ICEJA is Illinois, and you can reach out to each of the state SACs is what they're called, and they are funded by Department of Justice. And so We also collect and analyze data from the state police, the historical crime data, as well as the NIBRs. We help all of the local municipalities in their collection of the NIBRs. So each of your states have resources that can help you with that data.
Great, thank you. Another question from Linda Soderstrom asks, do we screen for undiagnosed learning disabilities where additional lifelong wraparound supports can help all young people? Does anybody know that?
I don't know who we are.
I guess they're asking the United States, any entity.
I don't know. Do you know?
Yeah, I can just jump in and say, just in terms of the issue of assessment more broadly, two things. One is, as I mentioned, a lot of those assessments take place at school. And so kids' connection to school is really important, but given since the pandemic, absenteeism rates are surging. Schools are usually such an important mechanism for diagnosing kids' needs and providing services. So any conversation around violence and meeting kids' needs also has to be connected to school attendance and school engagement and school services. And schools are also facing shortages in social workers and counselors and others to provide services. The other thing just to mention is that's why it's important to have some kind of early intervention structure. States are increasingly using kind of assessment centers where youth and families can go before they are involved in a system to get an assessment, whether that's of learning needs or of their risks, of their mental health needs, and get connected to appropriate services, rather than, again, having to wait till behaviors escalate and they end up in a system. So structures like family resource centers, assessment centers can be helpful to diagnosing young people's needs and connecting them with the right services.
Thank you. I think we have one more question, and I know we're almost towards the end of our webinar, but this person asked, Christy Griffin, there were a number of excellent programs mentioned to assist youth who have been abused, neglected, otherwise traumatized. These programs are very much needed. Are there programs or conversations about programs to address those who have and continue to advance racism and discrimination that largely creates the anger and frustration that leads to violence? How can programs be devised for young people who lean toward racist behavior?
That's an excellent question. There are models, plenty of models out there. There are lots of rites of passage modeling programs specifically for young people of color that really helps to advance their understanding and development of their history and who they are, and really try to build that self-esteem in them. But one of the things that's unique, and I encourage all states to do this, is look at our R3 program, because it's really centered. It has a community lens. It's centered in community. And that's where you're going to get those innovative programs where there is going to be culturally competent. It's going to deal specifically with what is needed in these marginalized communities. And government has to do more where we give community the voice to design the program. If we think about our evidence-based programming, it is always behind because you have to test, and then you have to, do a randomized sample research, right? But communities know what is going on in real time, and they can suggest programming that really gets to the core and the root of problems. And to your point, a lot of times that is racism, oppression, and lack of opportunity. Thank you.
Two quick things on our YES program. We do have a YES for basically an overall for all the different, there's a component in the YES program around ethnic identity. It was developed in Flint, and which is 80% African American, and so it focused on the African American population. But we also have one that's more multiracial. We also have one that's translated into Spanish and focused on more Hispanic populations. And we are currently working on a curriculum that we're testing, that we've developed, and we are in the middle of testing that is exactly focused on anti-racism. It's called Ideas. Yes, Ideas, and that's inclusion, diversity, equity, appreciation, and solidarity. That's what Ideas stands for. So, you know, that if you go to that website that I had on the webs, you can learn a little bit more about the efforts. That's not been tested yet, as I said. It does take a little bit, but we're in the middle of it, and the curriculum is available. So if you contact us, we could certainly share it. We'd be open to sharing it with you, knowing full well that it has been yet shown to be effective.
I'd like to thank everyone today for taking part in our webinar. And we're especially grateful to our three presenters this morning or this afternoon, depending on where you are. Josh Weber, Executive Director Del Reese Adams, and Dr. Mark Zimmerman. Presentations and other resources related to the webinar will be posted soon at csgmidwest.org. Also, there are 2 more webinars planned for this week as part of the CSG Midwest Season of Learning series. You can register for one or more of these webinars that you see on your screen on CSG Midwest's website, csgmidwest.org. Please feel free, too, to pass along the information to any colleagues you think would be interested. These webinars are open to everyone. Thank you again, and happy holiday season to everyone.
Thank you.